Hi, this is Gabby here with our patient, Ms. Rubin. She's here today for a follow-up after her surgery she had on her right hand. She had a right index finger, middle finger, and right ring finger extensor mechanism with sagittal band reconstruction with local tissue. It's been 3 months and 2 weeks since her surgery, and she's here to discuss her experience and how she's doing today. Go ahead.
Okay, well, because I've had long-term rheumatoid arthritis, my functionality in my right hand, actually in both hands, deteriorated to the point where I couldn't do many things. I couldn't pick up pills, I couldn't do just your basic things without my hand and my fingers locking up. And so I decided to start exploring and find out if there was any possibility that the situation could be improved so that I could get that functionality back. I just wanted to be able to sign my name, to write, to do the normal things you do in daily life. So I first went to my rheumatologist, and she suggested that I see a hand surgeon. And I decided to come to Dr. Cohen because I had done hand therapy right in the adjacent room with him for another matter. And I just liked the feeling of the office. Everybody was really competent, friendly, and spent time with me. That was the main thing that really impressed me. Most doctors right now have so little time, and they're rushing from one patient to another, and this office definitely gave me the feeling that that my situation was getting full priority, that I was in the hands of good people. And so basically Dr. Cohen examined my hand and asked me lots of questions about what I wanted. Did I want the hand basically to function or to look good? And I said, basically, my first priority is the function. And so he examined me and said he wanted to find out if I was a candidate for joint replacement because he was afraid, and here's where I liked his honesty. He said he could do the tendon surgery, but that it would revert back in some cases if the joints weren't in good shape. And so he referred me to a doctor at UCLA to get a second opinion. The doctor said my joints were fine and that either he or Dr. Cohen could do the surgery. Since I lived in Thousand Oaks and UCLA campus was in Westwood, I opted to go with Dr. Cohen because it would be convenient for post-operative care, as well as I felt he was a very competent physician. The surgery center was very, comfortable, I would say. In fact, because of COVID, I was the only patient in the center at the time. Everybody seemed very attentive. It was easy to get in and out of the surgery. The day of the surgery, I went home and just sort of rested a little bit. I was feeling no pain because Dr. Cohen had given me a treatment that would keep my hand pain-free for at least a day. And he didn't fully cast it. I really had like a wrap, which appealed to me because I wanted to have as much feeling of mobility as possible. And then I was really surprised because the very next day he had me in hand therapy, and I looked at my hand for the first time and was a little bit shocked because it was extremely swollen. In fact, I felt it looked like, sort of like the size of a baseball swollen. But the therapist assured me and the doctor assured me that that was very normal and that the swelling would go down and that I would see a full recovery. But as he had explained to me prior to the surgery, this surgery would take a long recovery time. And so I said, I'm committed, I'm willing to do whatever I need to do to get it back in shape. And so right in the first therapy or two, my hand was very painful. And I had to, even with just a slight touch to the hand, it hurt a lot. So the therapist was very gentle and explained that that would get better, which it did. Then soon after, I was doing exercises, and she did a lot of massage, heat therapy, and just things that weren't strain things. And we gradually got to the point where I kept trying to make my hand more flexible and to keep bending my fingers until I could make, as I do now, a full fist. And I can't explain the excitement I felt when my hand really behaved normally, where my fingers moved, I had control of my whatever I wanted to do with my hands. My only remaining feeling after 3 months is that I have a little bit of a tremor, like when I pick up a fork or something, and I've been told that that's due to the fact that my hand was in a splint for a long time and I was doing nothing with it, and I lost the strength. So right now I'm working on strength exercise, and I can see a difference already, that the tremors are going down. And even though it's still a little bit puffy along the incision line, I can see where that whole incision is going to disappear within a few months, and that the remaining bruise will go down as well. So I'm a happy camper. I'm glad I went to Dr. Cohen. I would recommend him to anybody, and anybody would feel like they're in good hands and that they'll come out with a good result.
All right, so if you can show everyone what you're able to do now, so if you can make a fist.
Can make a fist. I can use every finger independently, as compared to this hand that hasn't been fixed yet. See how it locks up? I can't do much with this hand. That's the condition. This hand was even worse than this when you first came surgery. This hand, even though I can bend it, it doesn't bend readily. It doesn't act normally. So probably after this one heals and I get up my resolve to invest the time to work on the other hand, I'll probably do the other hand as well.
Okay, so let's see everybody what the incision looks like. So surgery was done August 24th of 2020.
Yeah, it's been an incision right across here. The tendons were out of place, so he found them inside the hand and moved them and relocated them to where they would normally be. Put your hand flat on the table.
So as you can see, incisions right across her joint right here. So it's all of here, and it's healing nicely. It's been 3 months and 2 weeks, and we have a happy patient. Perfect.
Yes.
Thank you.
Thank you.